What's up, guys? K More Muscle, and today we're going to be talking about common respiratory illnesses. Guys, this is going to be, infants between 3 and 6 months are at our increased risk due to the decrease of maternal antibodies and the lack of antibody protection. So, guys, if you have an infant between 3 and 6 months, they're at increased risk for respiratory illness. Viral infections are more common in toddlers and preschoolers. Certain viral agents can cause serious illness during infancy, but only can cause mild illness in older children, right? So, guys, the younger they are and they get sick, that you should be more worried because their immune system is not as well developed. So, when a little small infant gets sick, it's more serious than an older teenager because they already have developed immune system. So, guys, for common respiratory illnesses, one of the biggest things is the airway can become easily obstructed with mucus or edema. So that's mucus or like swelling. This can allow infections to travel in the airways. And this can cause compromised immune system, anemia, nutritional deficiencies, chronic medical conditions such as asthma, cystic fibrosis, chronic lung disease, cardiac abnormalities, and exposure to secondhand smoke can also increase your risk for these respiratory illnesses. Children who have asthma have a greater incidence of respiratory infections during cold weather. RSV and other respiratory infections are more common during the winter and spring. Infections caused by pneumonia are frequent during autumn and early winter. So, guys, in these winter months and the spring and autumn, you're at more risk. You're at higher risk for RSV or pneumonia. Or the asthma acting up. So some expected findings include recent infections, medications taken, immunization status, and family coping. You can expect reports of a sore throat, decreased activity level, chest pain, fatigue, difficulty breathing, shortness of breath, cough, and decreased appetite. So now what are we going to do, guys? If we have an infant that gets sick or any type of, baby, we want to make sure that we monitor their heart and respiratory rate. We want to notice if they have retractions. So that's kind of like a weird breathing. Nasal flaring, like where it's hard for them to breathe, and restlessness, guys. These are all, signs that it could be, a possibility that their airway could close or they're not getting enough oxygen. Next, you want to make emergency equipment for intubation readily accessible. Guys, intubation is where they put a tube down the throat, which helps an infant or child breathe better. And so you want to have that readily accessible. You want to position the child to have optimal ventilation without increasing distress or without increasing distress that would contribute to increasing respiratory distress. You want to implement isolation precautions as indicated. Isolation precautions are a mask and gloves, and it's just a surgical mask, right? For airborne precautions, dust droplet precautions is that mask. Isolation precautions are to keep the patient isolated, to keep them away from others so they don't get them sick. And you want to use a cool air vaporizer to provide humidity. You want to rest during febrile illness. You want to make sure the infant or child is getting adequate fluid intake. They can have sports drinks or oral rehydration solutions. You want to administer medications that are accurate and during appropriate time intervals, and you want to develop strategies to stop the infection from spreading. And you want to do good hand hygiene. You want to cover the nose and mouth when sneezing and coughing, and you want to properly dispose of tissues, and make sure not to share, utensils or other things that could cause this sickness to get passed on to someone else. Anyways, guys, thanks for watching. This is respiratory illness, something that you don't want your child to have because this can cause them not to breathe as well. So anyways, thanks for watching. Thanks. Subscribe.